Yesterday we had an interview with Dr. Altia, and she mentioned about the sunflower, and people are confused that if that's actually a sunflower seed or so. Like, would you make them understand or like clarify what sunflower is all about?
Yeah. So when we say sunflower, it's not that sunflower we get in every nook and corner. You know, the shops. Na time pass food no, the seed that we eat. Na, but when we say sunflower, it is drugs community te or substance abuse community te. It is their local term. SF na or sunflower, and these drugs itu tahan market te especially in Nagaland bishi prevailing jai se, and then youth kan hoi or married men kan hoi libi itu drugs ki bishi khai nai like jai se.
All right. Thank you. And to Nagaland, to do like, what are the main complaints that like they come to you with?
Okay, there are so many problems here in Nagaland. You know, like it's not just a specific itu bimar karne aishe ini kabi no na, but then when it comes to example illness la aishe kuledu manuan they come with example anxiety, you know, depression kan thaka kan ini ka ahe na, or like borderline disorder khan thaka khan or schizophrenia na it one ai thake de, but then again addiction based te inya kon koise gule du opiate users khan like kwanishna to sunflower khan chola khan aru yabha khan chola khan na ganja kha manu khan aru shide tablet chola manu khan na, and then alcohol chola manu khan na inyan bishi ahi thake.
So what is the response of the patients towards the diagnosis?
Here, I would like to give an example before I go further. Many Nagas, many of our youths or many of our people, our own people, they come with Google knowledge with us. Like as in, we are not saying that okay, whatever you find in Google is not right or is not wrong. We're not saying like that. But like there are certain situations where patient will come to us and say that okay, I think I have depression, or I think I have anxiety, or I think I have ADHD, for example. They come to us, and if we ask apni la symptoms ki ase enika question do, they will keep on saying, and then they will tell us that moi Google kuri saishe ki my symptoms is also related to what is there in the Google na. But in many situations, whatever symptoms you see in Google hudai to apni la actually apni ki go through crazy to same na thake na. So that's number one. And number two, tahan responses after diagnosing their symptoms. Okay, it's all about like how a person accepts na. So kunba manuhandu tahan accept kurile ki okay, I have this problem or I have these symptoms na inikase, but for some people tahandu it becomes quite hard for them to accept the reality or accept the sickness they're going through na. But for all these reasons, that's the reason why counseling and then therapy mon provide great alongside medication.